Hey everybody, Dr. Jeff Picciarello here, coming to you with a regenerative medicine update. When I woke up this morning and I was looking for something to read with the idea of making a video today, I remembered that I had pulled an article off of my phone that I had been saving for about the last 6 to 8 weeks, and that I had not yet had found the time to be able to review this article. The article was actually published just about 8 weeks ago. It was published at the beginning of November, and it comes to us out of the University of Belgrade in Belgrade, Serbia. And when I saw the article initially pop up, I realized it was something I wanted to look at because it's something that really interests me. It's looking at regenerative injections of the knee, and it's comparing bone marrow to platelet-rich plasma and hyaluronic acid. It also interested me that it was coming out of Serbia. I had talked to Dr. Charles Runnels several times about his trip to Serbia several years ago. He was invited to lecture in Serbia to the medical school and to the medical staff at the university regarding platelet-rich plasma and his vampire techniques, the vampire facelift and vampire facial. And he always jokes that he was treated very, very well. He was almost treated like royalty when he was there because the only word in the English language that comes straight from Serbian is the word vampire. And being that he was the innovator behind the vampire procedures, he was treated very, very well when he was over there. But he was also amazed on how far forward-thinking they were with their regenerative procedures, especially PRP. They were doing bedside platelet counts with a platelet counter. And they were looking at platelet counts of the patient prior to drawing the PRP in the whole blood, and then they were looking at platelet counts in the PRP itself prior to the injection. And they were placing this data into the medical record. So they knew exactly what concentration of platelets the patient was getting at the time of the regenerative injection. That's something that I strive for here in the United States. I have several of my practices doing that, but the cost of platelet counters is very expensive, so I have not as many practices doing it as I would like. So looking at this study, they set out the study to look at whether bone marrow was significantly better than platelet-rich plasma and hyaluronic acid. It is essentially a bone marrow study. They are using the PRP and the hyaluronic acid almost as a control, especially when we look at the numbers. They looked at the study and they looked at 4 different orthopedic indices. They looked at the KOOS score, and they looked at the WOMAC score as well as the IKDC scores. And they charted all of these scores in a table right here, which shows the outcomes of the study. The WOMAC score is the one that we most often use in the United States. It comes out of McMaster's University in Western Ontario. WOMAC stands for Western Ontario McMaster's University Osteoarthritis Index. That is the WOMAC score. You can see the WOMAC score here on the right side of the screen. It looks at rating pain at 5 different activities. It looks at morning and evening stiffness, and then it rates multiple activities of daily living, all on a scale of 0.0 to 4, and that comes up with a total score. When they put those into the studies over here, we'll talk about what the results look like. There was initially 263 people enrolled in the study. We see here 68 were excluded right from the very beginning for not meeting inclusion criteria. Another 5 ended up not having the injections. 15 were lost to follow-up, with a total number in the study of 175. Out of that 175, 111 received injections with bone marrow aspirate, another 34 received injections with PRP, and 30 were injected with hyaluronic acid. All 3 arms of the study improved, and they improved to different degrees. The study did prove what it set out to prove, that bone marrow had the best results. Bone marrow had an average WOMAC score at the start of the study of 44, and the WOMAC score over a 12-month period of time dropped down to 24 with overall improvement of 20. The PRP group started at 48. The patients had a little more pain, a little more loss of function, and dropped down to 31 with a total improvement of 17. And then the hyaluronic acid arm started at 46 and dropped down to 35 with a total improvement of 11. You can see that they followed the data all the way out to 12 months, looking at improvement, and it does look like all three groups continued to improve over time. It did not reach a maximum improvement early and then taper off, but they did slightly improve throughout the entire study. As I said, I think this was written as a bone marrow study. They were wanting to prove that bone marrow was superior to the other two arms of the study, and they did prove that. What I found more interesting was the fact that PRP did almost as well as bone marrow. The total improvement in bone marrow, as I said, was 20. The total improvement with PRP was 17, with only a 3-point difference in the study on the 24-item Bmac index. I think that speaks a lot for the power of PRP. I know a lot of you that are listening to this video are doing PRP, whether you are doing it for aesthetics and sexual health, or you're also doing it for musculoskeletal and orthopedic injections. But it does show that PRP does definitely work. It does have significant improvement in knee arthritis, and it almost compares to the results that we are getting with bone marrow aspirate concentrate. I think this shows that PRP probably should be our first-line treatment in the regenerative field. If we have patients that are not improving after PRP, we can either accelerate this up to bone marrow aspirate if we are doing that in the office, or we can refer it to somebody that is doing that. I find the results very interesting. I will post the entire table 3 underneath the video, as well as a link to the entire article, so you're able to look at the entire article on your own. If you are already doing musculoskeletal regenerative injections with PRP or bone marrow, that's amazing, that's awesome. If you are not and you would like to learn, I do have an online course as well as a live course on PRP and joint injections. I will put a link to those courses also under the video. If you have any questions about the comments in this video, please let me know. I'd love to talk to you about them. I look forward to talking to you all very soon. I will put out another video probably in another 1 to 2 weeks. If you have something that you would like me to talk about, feel free to reach out. I hope you're all having a great week. Happy New Year, and I'll talk to you all very soon. Thanks. Bye.